Hello and welcome to our Nursing Hub channel, where experienced nurses teach their young. Today, we'll be discussing how to perform a head-to-toe assessment. Disclaimer: the content in this channel is for educational purposes only. Nursing students should follow their curriculum, and licensed nurses must adhere to their hospital's policies and procedures. Always prioritize patient safety and seek guidance from qualified professionals. You've just received the handover report from the outgoing nurse, and it's time to meet your patient. Best practice dictates bedside handover, fostering transparency and patient involvement. Unfortunately, many nurses still conduct handover reports at the nursing station. Let's break that trend and head to the patient's room. Upon arrival, introduce yourself and confirm the patient's name and date of birth with ID band. Taking a moment to survey the surroundings is crucial. Check for essential medical devices like the emergency box, oxygen, suction canister, and tubing to ensure they're in good working order. Scan the room for assistive devices like a wheelchair or commode. If the patient is connected to treatment devices such as IV fluids or oxygen, note their proper administration and settings reflect the doctor's orders. When doing a head-to-toe assessment, starting at the head moving downward systematically is best if patient is stable. So, we embark on a neurological assessment. A healthy assessment reveals a patient who is alert, oriented to person, place, time, and situation. They should be able to track you with their eyes, confirming intact neurologic function. Watch for signs of confusion, weakness, or changes in speech, which could indicate neurological impairment. Moving forward, we delve into vital signs. Heart rate, blood pressure, oxygen saturation, respiratory rate, and temperature are key indicators of hemodynamic status. It's essential to establish what's normal for the patient based on past trends. In a healthy assessment, vital signs fall within these parameters, signaling stable physiological function. Any deviations prompt further investigation. Note if abnormal results are symptomatic or asymptomatic, and remember to assess pain, a vital sign that is often overlooked. In continuing our examination, we inspect neck and face region. Inspect and note that mucous membranes are moist and the jugular vein isn't distended. Any deviations may indicate fluid imbalance or circulatory compromise. Ensure the trachea is midline, indicating proper anatomical alignment. Descending to the chest and lungs, we listen for breath sounds, looking for abnormalities signaling respiratory compromise. Healthy assessments reveal clear and equal breath sounds bilaterally, with normal respiratory effort and adequate oxygen saturation. Any deviations, such as crackles or diminished breath sounds, warrant further evaluation. Our assessment progresses to the cardiovascular system, where we listen for heart murmurs and assess peripheral pulses. In a healthy assessment, heart sounds are regular, with the distinct lub-dub of S1 and S2 present. Peripheral pulses are strong and equal bilaterally, with minimal or absent peripheral edema. Additionally, we address any complaints of chest pain, a critical symptom potentially indicative of cardiac issues. Furthermore, we ensure the integrity of the cardiac telemetry monitor if in use, confirming its intactness. We verify that all leads are correctly placed and note the rhythm displayed. Note for any irregularities, such as changes in rhythm, as this necessitates prompt attention and further evaluation. When assessing the abdomen, it's crucial to auscultate before palpation for an accurate evaluation. Begin by auscultating for active bowel sounds, especially in the right lower quadrant near the ileocecal valve. Afterward, assess all four quadrants for active, hypoactive, or hyperactive bowel sounds. Next, palpate the abdomen to check for tenderness, distension, or any lumps or bumps. Document the date of the last bowel movement and its characteristic. For the GU assessment, palpate the bladder to note any distension. If a Foley catheter is in place, document its type and size and ensure proper drainage by confirming that the Foley bag hangs below the level of the bladder. Lastly, assess the insertion site for any signs of inflammation, discharge, or discomfort. When evaluating the skin, thoroughness is key. Healthy skin typically feels firm and moist without any tenting. Keep a close eye out for redness, especially over bony areas prone to pressure ulcers. It's important to conduct a blanching test by gently pressing on these areas. If the color returns quickly after releasing pressure, it's blanching and indicates healthy skin. However, if the color doesn't return promptly, it's non-blanching, suggesting potential skin damage. remember to assess the skin on the patient's back, and if they're unable to turn independently, seek assistance. Consider providing perineal or brief care at that time, which allows for assessment of the peri area as well. Lastly, assess the skin integrity around any lines, drains, or dressings. This thorough skin assessment provides a baseline of skin integrity status at the beginning of your shift. Assessing mobility is indeed a crucial component of the head-to-toe assessment. It allows us to evaluate the patient's functional status and identify any limitations or impairments that may affect their ability to perform activities of daily living. When assessing mobility, observe the patient's ability to move independently, including their ability to sit up, stand, walk, and transfer from one surface to another. Note any difficulties or discomfort experienced during movement, as well as any assistive devices being used, such as walkers or wheelchairs. Additionally, assess muscle strength, balance, coordination, and range of motion in the extremities. A thorough assessment of mobility provides valuable insights into the patient's overall health and helps guide appropriate interventions to promote optimal function and independence. Including our head-to-toe assessment, the psychosocial evaluation emerges as a vital component. This aspect delves into the patient's emotional well-being, social support system, and overall mental health status. During the psychosocial assessment, it's crucial to consider factors such as the patient's mood, level of anxiety or distress, coping mechanisms, and any history of mental health conditions. Additionally, explore the patient's social support network, including family dynamics, living situation, and availability of resources. Understanding these psychosocial factors provides valuable context for the patient's overall health and informs holistic care planning. It enables healthcare providers to address not only the physical aspects of illness or injury, but also the emotional and social aspects, promoting comprehensive and patient-centered care. In conclusion, this quick head-to-toe assessment provides a broad overview of the patient's baseline upon receiving them into your care, allowing for early detection of any changes in their condition. However, it's crucial to acknowledge that a more detailed and focused assessment may be required based on the reason for admission and the specific systems involved. Before leaving the patient's room, ensure that the bed is lowered to its lowest position and that the call bell is easily accessible. Additionally, take a moment to reintroduce yourself to the patient, ensuring they are aware of your name and how they can reach you, such as via the call bell system. This simple gesture fosters a connection and promotes patient-centered care, enhancing trust and communication within the healthcare environment. Thank you for joining us for this head-to-toe assessment. We hope you found it helpful. Stay tuned for more educational content on Nursing Hub, where nurses teach their young. Feel free to share your suggestions for future topics in the comments. Don't forget to like, share, and subscribe.